So imagine, you're partway through a call, you think you're absolutely killing it, and then all of a sudden, a doctor throws a curveball at you. Your heart starts pounding, your palms start getting sweaty, you start thinking, oh no, what have I done wrong? Or maybe even panicking, how do I get out of here? Well, if this has happened to you, let me give you the 3-step process of how to get out. Number 1, I want you to breathe. Take a deep breath, and that's going to help you manage the amygdala hijack you're probably experiencing. Number 2, it's about mindset. And I'll never forget this quote from a senior colleague. He said to me, whenever you get an objection, just be curious, don't be furious. And the third one is having structure. And the structure is going to help you systematically break down the objection, ensure you've dealt with it, and then transition back to your call. And the structure I want to share with you is APAC. The A stands for acknowledging, the P for probing, the A for answering, and then the C confirming you have dealt with the objection and transition back to the call flow. Let me give you an example. Let's pretend I'm a rep working on drug X and I go in and see a doctor. She's complaining to me that drug X is causing lots and lots of side effects. Her patients are growing a third nipple. So this is how I deal with it. Number 1, acknowledge. Thank you, Dr. Smith, for sharing this with me. Number 2, let's probe. Dr. Smith, this is not something I hear commonly. Can you tell me more? She might say, David, heaps and heaps of my patients are getting this side effect. Now here, super critical, we are curious and ask questions. Do not get defensive. And the other watch out I'd say is when they say heaps and heaps, lots and lots, loads and loads, try quantify this, because what some people define as lots and lots, in my mind is, 90% of patients are having this side effect. But in her mind, lots and lots might be 3 out of the 10 patients she's tried the medicine on, which is only 30%. So coming back to being curious, okay, Dr. Smith, if we put 10 of your patients on drug X in front of us, how many would you say get this third nipple? And this can go one of 2 ways. Number 1, she says, look, about 2 to 3 patients will get it. In which case I'll say to her, look, Dr. Smith, thank you for sharing that with me. And I'm really sorry these patients had to go through that. Can you tell me what happened? How did you remedy them? She might say, I had to switch them to a different medication and they were fine. In which case, 20 to 30%, that's fine. Not every patient is going to respond to drug X. But if, on the other hand, she says 8 to 9 patients, 80 to 90% of patients are having this third nipple, and that's not something we see in clinical literature, I know she's sort of blowing up the figure, pulling my leg a little bit. And if you want to deal with this, you're going to have to watch the next video. But for simple objections, remember, breathe, have the right mindset, and follow the structure. My other tip is to front load the benefits of your medicine at the start of the conversation. Because when you need to call on your objection handling, it's probably too late to talk about your medicine's benefits. And you're already playing off the back foot.